Good evening and welcome everyone to our parent information series tonight on our Adapt for Life programming that's coming to Sycamore schools. Thanks for being here. I'm very excited to introduce our Adapt for Life team tonight and allow them some time to share with you more about this exciting opportunity that's coming to our students and our families in Sycamore. I'm Lisa Zelvi. I'm the Pupil Services Supervisor for the district. And I'm delighted to have the privilege of focusing on mental health services for the district. We have been discussing as a community for several years now some of the needs of our students, and certainly the pandemic highlighted some of the vulnerabilities of our kids and our families. And so through a partnership with Cincinnati Children's, we are really excited to bring our Adapt for Life series to Sycamore that will serve as sustainable mental health education for all of our students. So tonight it's exciting to introduce Stacy Hoffman and Pete Mazarin from Cincinnati Children's Hospital and the Adapt for Life program. And I'm pretty familiar with their presentation this evening. So as you have questions, feel free to put them in the chat. I'll respond in the chat if that's the most appropriate way, interrupt them if needed, or we can certainly target those questions at the very end. With that, I'm going to turn it over to Stacy and Pete for tonight's presentation. You are muted, Stacy.
Thank you everyone for being here. I was going to say just a quick check. Is my screen clear? You can see the screen that I'm sharing? Perfect. Wonderful. All right, thank you everyone so much for joining us. We are grateful for the opportunity to be here. So we are going to, over the next hour, we are going to do three things with you. First, we're going to review the results from our family survey. Secondly, we're going to ask you to move out of your comfort zone for a moment and do a mindfulness activity with us. And last but not least, we will be presenting 3 mini lessons, if you will, and we should also have time for questions. So first off, we'd like to start with our family survey. Sorry, I realized I just changed some slides today and it's not exactly what I expected. The first thing is thank you so much for your participation. Clearly, we know that in order to work in your district and to be successful in working with your children and the whole community, we need to know what your experience is. So we really appreciate you sharing some feedback with us. So the first comment on the family mental health survey is, I have adequate time to address the mental wellness of my children. And you can see that there were approximately 64% of you, which is wonderful, that agreed or strongly agreed that you were able to manage the mental wellness of your children during this difficult time. However, we will note there is still almost a quarter of us who are feeling either they disagree or strongly disagree about their ability to to address the mental wellness of our children during this difficult time. My children have the tools to deal with stress during these challenging times. It looks like about 50% of you said yes, you agree or strongly agree. Another 25% or so were in the middle somewhere. And again, another 24% feeling as though they did not have what they need in order to support their mental wellness in terms of our children. Our school has been able to maintain a sense of community and connectedness during these challenging times. Happy to see that approximately 58% of you are feeling connected to the district, but we see that almost 15% are feeling somewhat disconnected, and still another almost 20%, 18% or so, neither agreed or disagreed. When it comes to the mental wellness of our families and you as parents and guardians and family members, it looks as though a little bit stronger, 65% of you feeling as though you agree or strongly agree that you're able to maintain your mental wellness to your satisfaction. But still another 20% either disagree or strongly disagree about our ability to manage our mental health during this time. And the last question, I have the tools to deal with stress during these challenging times. Again, about 2/3 of you agree or strongly agree, but we are looking at another 14% that disagree or strongly disagree, and another 21% or so somewhere in between. So, these results really indicate that while some of you are feeling comfortable taking care of your mental health and the mental health of your children during this time, there's still a lot of us who are struggling. And Adapt for Life offers many tools and skills to support you and your family through times of stress. One of these tools is mindfulness. And I'm sorry that.
Here we go.
Okay.
All right. Even for those of us that feel like we have adequate tools, there's always room to learn more. And mindfulness is one of the core things to our program. And by focusing our attention, so we're going to do a brief exercise in a minute. And it's guided, so we don't have to worry about doing it right or wrong. By focusing our attention on the present moment, while calmly acknowledging and accepting our own thoughts, feelings, and even the way our body feels, we learn things about ourselves, our surroundings, and that includes other people. The pace and demands of life continually ask us to split our attention and energy, and it can be difficult to really know how we are feeling when we don't practice regularly checking in with ourselves. So mindfulness allows us to experience our thoughts and feelings without judging them as right or wrong. It's a state of being present in the moment, yet an ongoing practice with a variety of exercises and meditations. The insight we gain from regularly practicing mindfulness helps us learn more about ourselves and others and makes it possible to live healthier, more conscious lives. So now we're going to watch that video. Hopefully it works. Please let us know if there's any issues with the sound and you can't hear it.
I am anticipating a problem. I'm going to ask you to hold just one moment for me because I did indeed forget to click that button.
Okay.
And we're going to move right back into where we were, and it's going to work like a charm. All right. So with no further ado, here we go.
Stacy, we've got that black box.
Breathing.
Now it's gone.
Hey.
Close your eyes and rest your hands on your knees. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you're comfortable. Take a few deep breaths. While you're breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall each time you breathe in and each time you breathe out. And just allow your breathing to be natural and relaxed. Now bring your attention to the feeling of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each time you breathe in and each time you breathe out. As you inhale, maybe your breath feels cool. And as you exhale, maybe it feels a little warmer. When your mind wanders, or if you become distracted, just notice what's going on in your head And then gently bring your attention back to your breath.
I think you might have paused it, Stacy.
Going in and out. Focus on the feeling of your breath and allow thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat and open your eyes.
I'm feeling really relaxed after that. I could have fallen asleep. Now, please take a moment to reflect on your own feelings and what that activity was like for you. You notice the shift in what you're thinking about or how you feel? Hopefully, you feel more relaxed and calm. Mindfulness activities like this can make the most of fleeting opportunities for self care. So, this is an example of one mindfulness activity that we do with students. We practice smaller mindful moments for the younger kiddos, but getting kids to check in with their feelings and thoughts on a regular basis is core to our program. With mindfulness, starting at any moment is good. Pausing to notice what's going on with us lets us detach from the chaos and focus on the present moment. Acknowledge our experience before reacting out of how we feel, and learning about ourselves and our surroundings, including what's going on with other people. So now we will move on to our first of 3 mini lessons, which is the foundations of mental health and wellness. So as we've mentioned previously, your district was awarded a grant from the state of Ohio to bring mental health programming to students, educators, and families. And Cincinnati Children's Hospital Adapt for Life program is your partner. So congratulations on the grant. As we know, common language helps with understanding, especially with topics that can be emotionally charged, like mental health and mental illness. These terms are widely used, but what do they really mean? Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. While mental illnesses are health conditions involving change in emotion, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work, or family activities. Mental health is not simply the absence of mental illness, but like physical health, it's something that we must be aware of and work to maintain. Mental health impacts all areas of health and our functioning, including how we do at work, how we do at school, and our social and family relationships. Like with our physical health, we need to be aware of our mental health and take steps to improve and maintain it. We can be physically healthy, but still have allergies like the flu, etc. So let's take a moment to watch this video about how our society tends to view mental health.
Listen, I know you're sick and all, but are you even trying to get better?
Hey, look at it this way. There's plenty of people out there that have it worse off than you do.
You need to stop focusing on all the bad things in life and just try to enjoy it. It's all in your head.
I don't think you need to be taking medication every day just to feel normal. Don't you think it's changing you?
Listen, you really just need to suck it up. Like, everybody goes through this and you're just feeling sorry for yourself.
Why don't you just go to the doctor?
I can't. My insurance doesn't cover the flu.
Steven!
Hey man, that's broken. You need to see a doctor.
Seriously, I'm fine. I can get better on my own.
Sorry.
The video is, of course, a little tongue-in-cheek, but we would never think of discouraging somebody with diabetes from taking their prescribed medications or thinking that a broken bone is just going to heal on its own. But somehow these situations happen all the time, and these statements are made frequently when it comes to our mental health. When stress builds up or an individual develops a mental illness, early intervention leads to better outcomes. So this means the sooner that the person gets help, the less likely their mental health condition is going to negatively impact their life. As we all know, early experiences shape the brain, but they also affect mental health. Children who experience better mental health have better performance in school and stronger relationships. Early learning of skills and mental wellness can address many problems, including incarceration, homelessness, and the failure to complete high school. And to help us understand what this looks like, these are from a recent study which found that behavioral and emotional problems experienced at age 3 were associated with below grade performance at age 12. Similarly, mental health problems at age 12 were associated with students not completing high school, which impacts their ability to achieve gainful employment or higher education. So symptoms of mental illness do not simply go away if ignored, dismissed, or left untreated, and their impact on an individual's life is magnified. And there's a tendency to think of mental illness stereotypes that we see portrayed in movie and or TVs. And sure, these are all symptoms, but these are not the only way it shows up. But our typical stereotypes when we talk about mental health in our students would be, a child showing signs of defiant, aggressive, or attention-seeking behaviors. They may be struggling with mental illness. Others may be experiencing depression and suicidal ideation. While depression is certainly a common mental health condition, anxiety is also very prevalent, and both can cause difficulties in concentration. Children who experience test anxiety may be struggling with anxiety in other areas of their lives related to performance and success. High performers or students that seem to have it all may not come to mind when we think of mental health struggles, yet they can be masking the pressure and strain of trying to be perfect and fit in. Substance abuse, self-harm, and similar types of behaviors are all too common in students who are struggling with mental health conditions. We know there is a need to support the whole child and help them achieve better balance in their lives. So what's being done? The state of Ohio has introduced social emotional learning and positive behavioral intervention supports initiatives to address the mental well-being of children at our school. Adapt for Life takes these initiatives to the next level. It is an engaging multimedia program designed to teach children to be aware of their feelings, thoughts, and the results of their behaviors, as well as the experience of those around them. Adapt for Life teaches students to be proactive in managing stressors in their lives. Gaining awareness of their own experiences as well as those of others will encourage empathy and compassionate action, things we all want to see more of in our schools. Adapt for Life supports students in a progressive, multifaceted approach with learning experiences that align to SEL and PBIS competencies and are designed to integrate into and strengthen what your school is already doing in those areas. So Lisa has brought you a number of great initiatives. We don't want to throw out the baby with the bathwater. We can incorporate those and build upon the good work that's already being done. Our program also supports the whole student in each grade level and positively influences the school culture. In early years, students learn to identify and express their emotions and the importance of getting help when they are struggling. And then as students develop cognitively and emotionally, concepts progress to include awareness of self and others and the effects of our action on others. Continuing with assessing behavioral change, warning signs of a crisis, and how to intervene and reach out and help someone else or get help for themselves. Students will emerge from the program with greater emotional intelligence, including empathy and compassion, crucial life skills to manage stress, achieve goals, and strengthen relationships, and improved future opportunities due to better academic performance and mental health. Many children are struggling with treatable mental health conditions. Unfortunately, in Ohio, there is a lag in getting treatment that averages over a decade. Research continuously shows that earlier intervention leads to better outcomes. Adapt for Life equips students, educators, and families with the information necessary to identify when and how to get these students help, which helps close the gap in treatment and creates positive outcomes in their lives. In order to create a positive environment, Adapt for Life is a multi-year experience with a common language for shared understanding across your district and as students move from grade to grade. Our multi-year approach includes early building blocks of mental wellness to help increase students' ability to manage and adapt to stress in later years. Ongoing experiences provide continued support for middle and high school stressors. Adapt for Life skills and tools provide content in age-appropriate ways. Sustainable mental wellness culture change is our goal. With our common language, we are able to reduce stigma, making it easier for all to talk about mental health and for people to feel comfortable in getting the help that they need. Build comfort as students, educators, and families learn and practice with the language. Enhance understanding as students become better able to articulate their feelings, their thoughts, and describe behaviors. And expand concepts as students engage with the program year after year. It is important to model mental wellness and self-care for our children and each other. In addition to our student-focused programming, Adapt for Life offers training and support to educators and family members. Adapt for Life teaches concepts and skills to help us manage our own stress, to intentionally respond to stressors, and be more patient, present, and responsive to our children's needs. Family and educator training is vital to student success, and it benefits all family members in everyday moments and during times of crisis. Self-care is a learned behavior. We can empower our children to take care of themselves as we model the way to do so. There's many benefits to self-care. We do so much for our kids. As parents and guardians, we take care of others. However, we need to spend a lot of time taking care of ourselves as well. Benefits, never mind. The benefits of self-care include lower stress and increased happiness, better sleep, healthier diet and eating habits, decreased irritability and frustration, more patience, improved focus, motivation, and energy. We encourage you to check out our newly designed website, which includes lots of helpful information. We've tailored it by audience, so you can see there's a section for family, one for students, and one for educators. We'd also like to draw your attention to these ADAPT guides you can find on our websites. We created 4 audience-specific guides to help students, educators, families deal with the challenges of the pandemic. It's kind of our way of applying our skills to this specific stressor that we're all dealing with. So we hope you take a few minutes to review those. So our key takeaways from the first lesson is that early intervention leads to better outcomes. Mental health does not mean the absence of mental illness. It means having the coping skills to overcome challenges, and coping skills are behaviors that can be learned at any age.
Our next mini lesson is depression, anxiety, and suicide, as well as what to look for and how to help. Depression is a state of low mood and aversion to activity. It can affect a person's thoughts, feelings, motivation, behaviors, as well as sense of overall well-being. It's common for people to experience depression at some point in their lives. Anxiety is the body's natural response to stress, a feeling of fear or apprehension about what's to come. The first day of school, going to a job interview, and giving a speech are all typical events that may cause anxiety. Let's begin with depression. So Depression is more than feeling down or feeling blue from time to time, yet it's a common condition of the brain. It's a serious medical condition that not only affects our thoughts, feelings, and mood, but also our behaviors and our physical health. Depression isn't caused by one reason. It's more of like a perfect storm. It typically is a combination of genetic, biological, environmental, and psychological factors. And not every person who is depressed experiences every symptom. Some people may experience only a few symptoms, while others may experience many. Here are the symptoms of depression: persistent, sad, anxious, or empty mood, feelings of pessimism or hopelessness, loss of interest in hobbies or activities, changes in sleep, either more or less. Even the way that our bodies move and the way that we speak can either be sped up or slowed down. Appetite or weight changes, unusual fatigue, or feelings of guilt, worthlessness, or helplessness, difficulty concentrating, even just remembering and making decisions, and also thoughts of death or suicide attempts. Now we'll take a look at anxiety. So with stress, we know what's worrying us. We know what we're upset about. But with anxiety, what we're anxious about becomes less of a problem, and being anxious becomes more of the problem. What I'm saying is that we start to get anxious about being anxious. And anxiety, we know, can be in response to a specific trigger or situation, but it can also be more general and widespread. Anxiety often begins in the years right before puberty, and it includes persistent feelings of inner turmoil and excessive worry, repetitive thinking that doesn't stop, and nervous behavior, somatic complaints like headaches, stomach aches, those types of things. There is a range of symptoms that people can have when they're dealing with anxiety. People who struggle with anxiety can have symptoms like restlessness, difficulty concentrating, and feelings of worry, while other times people's anxiety may show up as fatigue or difficulty sleeping or hypervigilance. Has your child ever suddenly become overwhelmed and shut down? Or perhaps a family member or a friend? Anxiety can escalate quickly, and a person may experience a panic attack. A panic attack is a telltale sign of anxiety and involves a specific experience of heightened fear and discomfort that often involves sweating, trembling, heartbeat, nausea, chest pain, difficulty breathing. And they usually feel extremely uncomfortable for people who are experiencing them. Many people feel as though they're having a heart attack or another life-threatening issue, even feeling as though they may die. Panic attacks differ from typical fear responses because there's not an actual threat involved. It's more in the way we see things. And it can be triggered by something, yet often we don't know why someone has a panic attack, which makes it even more stressful to those individuals feeling that they can't control when they may have another one, that they don't want to be in a particular situation or an environment that leads to a panic attack and causes them embarrassment or discomfort. If you are with someone who's experiencing a panic attack, there are some things that you can do to help. Stay calm. I know it's hard to do when someone's upset, but try to stay calm and just keep a watch. If you need to be at a distance to make them feel better, you can certainly do that. But reassure them that you're not going to leave. Remind them that it's temporary, that it's not going to last very long, and ask how you can help. If they're able to tell you how you can help them, that's fantastic. If not, you can try to get them to breathe slowly with you, or having them focus their attention on something tangible or physical around them, or sometimes even just changing their environment can be helpful. Please resist telling the person to calm down, dismiss their feelings, or question, doubt, or ridicule. If you yourself are experiencing a panic attack, again, it's important to remember that the panic attack will end. Again, breathing, paying attention to your physical environment, or touching things around you can be really helpful in grounding us during these really stressful situations. So depression and anxiety are treatable mental health conditions, yet 60% of our kids with diagnosable depression and 80% of our kids with diagnosable anxiety disorder are not getting treatment. Why is this? How does this happen? Well, let's take a look at how we as a society view mental health. We don't have a common agreed upon language for it. There's so many ways that we talk about it. We can say an illness or a condition or a disorder, and all of those things bring to mind different images. Some of these terms come from language roots that are language that is rooted in judgment or in fear. The reality is that there is a stigma around mental health and mental illness, a perceived negative attribute that causes someone to devalue or think less than the whole person. Unfortunately, stigma is so real in our society that a lot of times people who are feeling uncomfortable or they're having some mental health struggles, they don't feel comfortable voicing them and sharing that, and they internalize their struggle. Unfortunately, sometimes this can lead to people feeling overwhelmed and considering suicide. So let's just take a moment to review some important information about suicide and suicide prevention. Suicide is the leading cause of death for children ages 10 to 14, and the second leading cause of death for people aged 15 through 34. In 2018, there were more than 2.5 times as many suicides in the United States than there were homicides, but we don't hear so much about the suicides. We hear about the homicides. Let's align on language. Again, suicide is death caused by self-directed injurious behavior with the intent to die as a result of that behavior. A suicide attempt refers to a non-fatal attempt to die by suicide. It may or may not result in injury. And suicidal ideation refers to thinking about, considering, or planning suicide. It gives tremendous hope to share this statistic and know that 50 to 70% of people who attempt suicide talk about their thoughts, feelings, and plan before they do anything. And for our kiddos, 67% of students tell a friend that they're feeling suicidal before they tell anyone else. So this is why we need to have our students knowledgeable about the warning signs and how to talk about these risks. After a suicide, we can look back and see warning signs in 75% of cases. And again, that's why learning about these and being able to recognize these signs can help give us a chance to reach out before it's too late. Warning signs of suicide include the first three seem somewhat obvious, but they're still worth noting. Talking about wanting to die or kill oneself, looking for a way to kill oneself, perhaps researching methods on the internet or gathering memes, preoccupation with death. If you can get someone you're concerned about to talk about how they're feeling, listen for themes of humiliation or feeling like a burden to others, feeling helpless or hopeless and not having any meaning in life, and feeling trapped or being in unbearable pain. The next set of warning signs really have to do with behavior changes, and this is something we talk about at length during the program. But changes such as increasing the use of alcohol or drugs, acting anxious or agitated, reckless, self-destructive, or high-risk behaviors, sleeping or eating changes, withdrawing or feeling isolated, showing rage, or talking about seeking revenge, displaying extreme mood swings, saying goodbye, unexpected visits, giving away prized possessions, or a sudden sense of calm. Unusual neglect of personal appearance, not tolerating praise or rewards, persistent boredom, difficulty concentrating, or a decline in the quality of schoolwork, and frequent complaints about physical symptoms often related to emotions such as stomach aches, headaches, fatigue. We know that there are some experiences that increase our risk of suicide. And these include having a friend or a family member that has a history of suicide, if a person has themselves had a previous suicide attempt, if someone's been a victim of abuse or trauma or bullying, if they're experiencing significant grief or loss, if they have another depression or another mental health condition, if they're experiencing challenges related to sexual orientation and or gender identity in an unsupportive environment, physical illness, substance abuse, unwillingness to seek help, or other barriers to care, and certainly we know easy access to lethal means all increase our risk of suicide. Children and teens who experience depression, anxiety, and other mental health challenges feel as though they're all alone. Talking about mental health regularly and in a supportive manner encourages people to reach out for help. Let someone that you're concerned about know that they're not alone. Suicide is preventable. Our key takeaways from this part of the presentation: many youth experience mental health challenges that are treatable. Stigma creates an obstacle to reaching out for help, and everyone can support a community that looks out for one another. Suicide is preventable. And we do provide a list of resources to teachers and students and family members. I'm going to talk a little bit more about these after our next section. For now, we'll move on to our last mini lesson, which is an overview of the ADAPT framework. So as we've shared, one of the key components of our program is vocabulary and aligning on language. Whenever possible, we use our terms and we show children how to use them. So words, and when we talk about adapt for life, it certainly sounds like something positive, but what does it mean to adapt? To change one's behavior so that it's easier to live in a particular place or situation. And so ADAPT and our ADAPT framework underpin all that we do and what we set out to accomplish in this program, which is to help young people, our children, change their behaviors and develop skills so they can help themselves and others manage stress, overcome obstacles, and maintain their mental health to lead healthier, more fulfilling lives. Each step of the ADAPT framework includes a concept, a language, and skills. The first step of the framework is awareness. It all begins with attention. We don't all see things the same way. So becoming aware of ourselves and others begins by paying attention and noticing, observing, and listening. Being aware is much more comfortable than experiencing confusion or ambiguity. So I'm going to give you a silly little example of what I'm talking about. I think we can probably all agree that this emoji means happy and that this one means sad or crying. But how about this one? Well, I was confused myself, so I looked it up. It's what they call a grimace emoji, but I've had students tell me that it's a fake smile, or it's someone who's cold, or someone who's saying eek. The moral of the story is that if something as simple as an emoji can be confusing, just think about how confusing relationships and conversations and experiences can be. Our goal is to help students better understand and the need to be aware. And to activate awareness, we encourage them to ask questions. Look and listen to what is really going on around you. What do you see and or hear? What connections or relationships are present? What makes sense? What you notice and pay attention to may seem typical, it may seem clear, but what's not? What you notice and pay attention to may seem confusing, ambiguous, or not quite right. Again, by asking students to stop and become more aware is our first step to good mental health. Our next step of the framework is describing. Connecting words to our experiences helps us to understand them. So by describing our thoughts and feelings, as well as the behaviors we see in others, helps us understand how we're coping with stress. So how do you translate your experience into words without judgment? It's harder, it's not an easy thing to do. People often lump together thoughts and feelings, sometimes even confusing feelings for thoughts or vice versa. The reality is that although feelings and thoughts are related, they're quite different. Describing our thoughts and our feelings can help us understand their impact. And when it comes to learning about ourselves, we can also become aware of our triggers and our cues. Our triggers are things in the environment, stressors, situations, people, places that bring stress to us, Cues are signs that our bodies give us that we're becoming stressed. Describing both triggers and cues are important to helping students recognize and understand their individual stress response. When others don't share their thoughts or feelings with us, we can look toward their behaviors to tell us how they're doing. So we know that behaviors are an important clue to understanding what's going on. So this is why it's so important to describe what's happening and what we're seeing, taking the time to translate what we are really seeing or hearing in someone. Rather than focusing on individual behaviors, it's more about the collection of behaviors that we see that as it compares to what's typical for that person. So for example, we may have a student who's typically calm, smiling, vents, and isn't really angry very much, doesn't complain a whole lot. But more recently, maybe this person is agitated, is not smiling, arguing and ranting, being hypersensitive, and complaining a lot. It's this change in behaviors, the collection of behaviors that lets us know that this person is struggling. And it's through describing those behaviors that we're able to become aware. The third step is assessing. Evaluating that which we describe provides important information about what we need to do next. Assessing how we or others are managing stress allows us to help or to ask for help or to help others, especially if there are warning signs that need to be addressed. Our society is constantly making assessments, but we know that the first two steps of this framework, gaining awareness and describing, are critical to making accurate assessments. We know it's important to assess obstacles. Things are going to come up that make it difficult to reach out and help someone or to ask for help for ourselves. Maybe you feel like it's worthless to talk to someone about what's troubling you, that they won't listen or can't understand. Or maybe you feel like you shouldn't ask for help because you should be able to handle it on your own. When it comes to helping other people, maybe you worry that you'll violate a friend's trust or that you might say something wrong to even make a situation worse. Or maybe you just don't have time that day. There will be reasons why we don't want to or can't get involved with helping someone. Most things that are worth working for bring challenges. Obstacles to helping yourself or someone else are normal, inevitable, but they can also be overcome. So this is something that we always explore, especially with children. Again, assessing behavior change, driving more for the collection of behaviors as compared to what's typical for someone. Because sometimes we know that some behaviors can be considered warning signs of suicide. Lastly, again, there are behaviors that we know can be warning signs of suicide. Being able to recognize these and reach out can help to save a life. The fourth step in the framework is planning. Having a plan and practicing with our tools helps us take action when it's needed, leading to better outcomes. What do we mean by a plan? Well, to arrange or decide on in advance. Many of us work with our kids to plan all kinds of things. And generally, when we have a plan, things seem to go better. The same is true when it comes to a mental health crisis. We know that often people who are experiencing mental health crises feel as though there is no one available to them. So asking them to think about their plan before they're in a state of crisis can really help them have that to fall back on when they need it. So a plan for stress also includes seeking out the activities, the people, and the places that make us feel better, more calm, stronger, more supported. And again, thinking about our go-to people before we're in a difficult situation can help us know who to go to. And keeping those phone numbers on hand is invaluable for our children. The last step of the framework is talk, tackle, and thrive. Our stress does not define us. Coping with our stress in healthy ways allows us to live our best lives. Thinking about our experiences helps us tackle stress, and using ADAPT skills will help us live healthier, more fulfilling lives where we can reduce stress and thrive. Why is it important to talk? Because people can't read our minds. Why is it important to tackle? Because stress is inevitable. And why is it important to thrive? So that we can develop and grow. Adaptive coping leads to more desirable outcomes and ultimately reduces our stress. The ADAPT program offers a toolbox for you to try different behaviors. Learn what works best for you and make a priority out of doing them. Our key takeaways from this part of the presentation is that stress is a part of life. Our ability to respond to stress can improve our outcomes, and using ADAPT skills will help us live healthier, more fulfilling lives where we can reduce stress and thrive. As I mentioned, we do talk about these resources in the program, and I just want to go through them briefly with you. The first one is a crisis text line, and it is just that. You can text HOME to 741-741, and you'll be connected to a clinical counselor. It's free from anywhere in the United States, 24/7, 365. The National Suicide Prevention Lifeline is like a hotline, and it is also available 24 hours a day. You don't have to be in crisis to call this line. They also can help you talk through maybe next steps or ways of addressing a problem or a stressor that maybe someone in your family is experiencing. A local resource is Cincinnati Children's Psychiatric Intake Response Center, commonly called PERC. And PERC has two sets of professionals who can be helpful who offer helpful resources. The first one is a group of clinicians who work in our emergency departments doing psychiatric assessments to ensure safety of children and adolescents. So one of those staff members can get on the phone with you, talk about what's happening with your child or with your friend, and really help you decide on what the next step would be. Additionally, they have an intake team, and this intake team has an overwhelming amount of information about local resources and services here in our area. So by talking with you, learning about your resources, where you live, what your schedule is like, they can actually help connect you to a provider that can work with you or your family. And lastly, our ADAPT framework definitely provides a resource that folks can turn to for support in times of stress. As your child participates in ADAPT for Life, please help them make connections between the framework and what it means to them. Again, we are grateful for the opportunity to be working in your school community and strengthening mental wellness for all. Thank you so much for being an active part of this process. We appreciate you. I think maybe you've seen this website before, but always want to encourage you to come back to the website. There's a lot of information on there that can be helpful in gaining mental wellness for yourself and for your family. And that is the end of our presentation. Thank you so much for listening. We would love to have the opportunity to answer any questions that anyone might have at this time. I know that perhaps there have been some things in the chat as well, Lisa.